All right. Well, welcome and thank you for being here. Thanks for your interest in our yoga therapy for chronic pain 6-week group program. The intention of the time that we'll be spending together now is to just get a bit more information about the program, about myself, about what to expect, and hopefully answer some questions that you may have, some curiosities that you may have about the program. So my name is Carrie, and I will be leading the program. I am an experienced yoga teacher. I've been teaching yoga for about 14 years. I'm also a certified yoga therapist, working primarily with people with chronic or persistent pain and people in trauma recovery. And the reason why I've landed here is because of my own personal journey with chronic pain in my late teens and throughout my 20s, and really finding it difficult to get the support that I needed, and saw many different practitioners and healthcare providers with little resolve. And I was left in my 20s with being told that I would just need to live with the pain. And that was very disappointing and disheartening and a lot to take on. And so in 2006, I discovered yoga and started to find some relief in my body. I also started to see a reduction in stress and improvements in my mood. And since then, I've continued to practice yoga, to study in becoming a teacher, and been teaching for many years, and went much deeper in the persistent pain and trauma training to help support people so that they can live better. And so the practices and tools that I guide through the program are tools that I apply in my daily life, whether it's an acute injury or pain, or it is persistent, something that has been with me for a long time. And so when we talk about pain, there is an official definition by the International Association for the Study of Pain. And it says pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage. And so it's unpleasant to get your attention. It's unpleasant to get you to change something. And we talk about it being actual or potential tissue damage. And so that can be warning you that there is an injury that is about to happen, or it can be related to pain that has been sticking around for a period of time. And probably the most important word in that definition is the word experience, because pain is related to the experience that you had, experience that you have had in the past, as well as future thoughts and worries. So all of that helps contribute to the complexity of pain. And we all experience pain in movement, like walking, exercise, regular daily activities, getting up and down, and sometimes it's from doing nothing at all. Yeah, so sometimes with little movement or at rest, we can feel pain, and it changes over time. And pain can be influenced by many factors: your breath, your thoughts, the tension that you might be holding, anxiety, fear, past experience, also things like grief and trauma, sleep, emotions, and so much more. And some of us have a tendency to push through our pain. Some of us have more fear around movement. And for many of us, we have a combination, and it will depend on the situation. And so some pain and acute injuries will stay within the typical time frame, and some will last beyond that 3 to 6 month typical healing window. And there are 1 in 5 Canadians that are currently living with persistent or chronic pain, and that number continues to rise, unfortunately. And so with this program, we start to explore different ways to change and influence pain through the tools that we have within ourselves. So things like movement, breath, thoughts, awareness, and practice. It is about dedicating a consistent practice. It's not just showing up once in a while, once a week or so, and hoping to find resolve. It's about dedicating yourself to your own healing journey and learning new tools along the way. And so this program is based off of the Pain Care Aware program and movement guidelines created by Neil Pearson, who is a pain science educator at UBC, educating doctors and physios and other clinicians. He's also a physiotherapist and a yoga therapist. And this program was created alongside his wife, who is a Kriya Yoga Swami. So we have a combination of science and the physical therapy side, as well as the yoga that has been combined to create this program. And so the Pain Care Aware program is a combination of pain science, so understanding how pain works and why it sticks around for some. It's around getting greater awareness around yourself, how you might hold tension, how the thoughts may be contributing to your pain, and about your breathing, as well as others. And then it's about practicing and learning regulation techniques. And regulation is when we change things. It's when we go from noticing what's happening to trying to change. So that can be regulating your tension, trying to reduce the tension. It can be regulating your breathing, and also calming the thoughts, all of which help calm the nervous system, which also help reduce your pain. And we use what we call the movement guidelines. And these guidelines help us determine how to move our body safely, to listen to the signals and to challenge the tissues as well. So when we talk about fear of movement, that can also be prohibiting us from healing. So the movement guidelines help us explore with curiosity in a safe way with the support of myself. And through movement and breathing, we're able to make the tissues healthier and stronger. And so how is this different from seeing another healthcare practitioner? It's different in that we're not trying to fix or change certain parts of your body or health conditions. It is about empowering you with tools so that you can embody these practices and start to make changes from within. And so this is not to replace your other healthcare practitioners. This is to be complementary. So if you are already seeing physio or in another sort of treatment or recovery program for injury or conditions, this is just to help further equip you with more information, more tools and practices, and perhaps you start to see some relief and don't need to go see certain practitioners or take the same amount of medication, possibly. And so that's a little bit about the program. Each week, we will be starting with a centering. So we all arrive in the group together. We do some grounding and centering. We will also get to know each other a little bit. So the group size is typically anywhere from 6 to 12 individuals. And they are sometimes in the studio and sometimes practicing from home. And the nice thing is you have the option to do either, and all of the sessions are recorded. So if you can't attend them all, you can catch up later. And so once we do our grounding and check-in, then we will start to explore different practices. And sometimes they will be more subtle body practices where we will be checking in with awareness. So noticing what's happening with our breathing, our body tension, our thoughts. And then often we'll be moving into regulation, so where we try and change things. And sometimes that will be breath practice. Sometimes it will be movement with breath. And often it's a combination. And each week we will progress. We will also each week learn some pain science, because that can be really helpful in gaining a greater understanding around the why, which can be empowering. We will also touch on some yoga philosophy and aspects like ahimsa, which means nonviolence or non-harming. So, and that is in relation to how you move your body, what you put into your body, the thoughts, and also how you speak to yourself. So we're often really great at offering others kindness and compassion, and we might not be so great at doing that for ourselves. So when we can embody that same kindness and compassion that we offer externally, when we can offer that to ourselves, that can also contribute to feeling less pain and more like ourselves. And so each week there will also be opportunity for sharing should you choose to. Of course, you don't have to, but it can be helpful to be in community with others. You will receive handouts for every session where you can choose to take notes or not. And there will be information provided, like extra links and videos to watch where you can learn more if you want to. All the practices that we do will be audio recorded. So I put them in a shared drive for everybody, and that way you can actually practice them on your own. So I don't expect you to come and try it once and be able to do this on your own. So if you choose to explore more, then you can try on your own and practice. And the more we practice, the better we get, just like learning any new skill. This particular program is not for a specific injury, condition. It is typically full of all different types of people in all different stages of their life and mobility and recovery. And it is always modified. So whenever we do movement, you have choice in everything that you do. So some days will be a rest day and you can visualize. Other days you will feel like more challenge. And sometimes it's a bit of both, but you'll be always supported with different modifications based on what you need. And you can take the class seated, lying down, standing. If you're at home, you can use whatever you have around you. At the studio, we have wonderful props like blocks and yoga bolsters to help support you. And really, movement is medicine, as well as the breathing. So we're always going to be exploring movement and breath along the way. And so this is a time to be curious, to explore, and to maybe learn some new techniques that might help support you. There's no experience level required. Typically, there's a variety. Sometimes we have former athletes, and sometimes we have people that are not able to move a lot. And it's a wonderful combination of meeting everyone just as they are. If things to bring to the class would be, if you have your own yoga mat and you want to use it, you can. We have all the props that you would need in the studio. If you're at home, you can use things like pillows and blankets and your couches and ottomans. And then we bring water. What else did I want to say before we practice? I think that's about it. I wanted to try just a little practice so that you can see what it might feel like. And this is just one very brief practice. They are all quite different. Sometimes we'll focus on just our breathing. Sometimes it will be more about body tension. Sometimes it's about thoughts. But right now we're going to try what we would call a body awareness practice. So where we're going to check in. And so when we talk about awareness on its own, typically we go straight to fixing and changing things, trying to fix the problem. And sometimes when we take a few moments to become more aware of what's actually happening, then we're better equipped with the information as to what do we do now? What's next? So if you'd like to give this a try, you're going to find a comfortable position. So you can sit or lay down. If you're seated, you might sit against a wall or sit against the back of a chair so that you feel most supported. And if you want and you're comfortable closing your eyes, you can do that, or just let the eyes soften towards the ground. And just start to become aware of all of the feelings and sensations as it relates to the support underneath you. So what do you feel touching your body right now? And notice right away if you're resisting some of that support. And if you could soften and let that support be there for you. Know that you are grounded and supported in this moment. And just let your breath flow at its own pace. You might notice if you're holding your breath. If you do catch yourself holding your breath, just let the breath flow again. But start to bring your attention to the back side of your body, the whole back side. Feel where you're in contact with the support underneath you. And now start to notice the front side of your body. You might notice the movement of your body as you're breathing, or you might feel the weight of your clothing against you. And then start to notice just the lower half of your body. So from your waist down, just check in. Notice what you're feeling, if there are sensations, maybe there's an area that's calling your attention. And then start to take your awareness to the upper half of the body. So from the waist all the way up to the top of your head. Just noticing what's happening there. Staying present as you notice what's happening through the upper half of your body. And now start to notice just the left side of your body. So you could draw an imaginary line down, and maybe you start at your foot and move your way up, just checking in with the whole left side. Notice tension, notice space. Maybe there's discomfort or pain as well. And now move over to the right side of the body and just start to notice the whole right side and what's happening on that side. And maybe as you observe the right side, you're now noticing a difference between the right and the left. And different isn't bad. We're just noticing what's happening. Nothing to fix or change, just observe. And now that you've taken a few moments to check in, based on what you noticed, is there an adjustment to your body position? Maybe there's a little bit of movement that you'd like to take so that you can find more connection and more ease. And so that's an example of a basic, short awareness practice where we check in. And so sometimes checking in on its own can shift things. So maybe you noticed you were holding tension in your shoulders. And so that could be an area where you could start to move and change things, move into regulation. So an example of a regulation practice to help with tension through our shoulders would be sitting up tall or laying down in a supported shape and taking a long breath in through the nose and a long breath out from either the nose or the mouth. And do that a couple more times. Just find your breath, breathing in and softly breathing out. One more time, just like that. Now, the next time you breathe in, take your shoulders up towards your ears, maybe just a little bit today. Now, as you breathe out, let go of some of the tension. Let the shoulders come down. And then again, breathing in, lifting your shoulders as much as you want to, whatever feels safe. And exhale. Let it go. So one breath at a time. We're softening, we're letting go of some of the tension. You might stick with this for a few more cycles of breath. You might feel like that's enough. Your body may also feel like it needs more movement or a different movement. So this is an example of a very brief movement practice where we would begin and then we would build. And we would move, or you would move, based on how you're doing today. So for example, if we were to start reaching our arms up and you had a shoulder injury or discomfort on one side, then focus on the side that feels good at first. Visualize the other side moving with ease. So you get to decide how you move. We start with moving our bodies in ways that feel safe and good. And when we get comfortable and are ready to explore more, we move a little further, move our body in different ways, start to challenge the edge of what feels like challenge for us. And that's how we work towards improving tissue health. Getting the breath involved and reducing our tension along the way can be really helpful because we know when we hold our breath and when we tense our bodies and when the thoughts are negative, that those all contribute to an increase in pain. So those are some of the aspects that we cover through the program. Each week will be different. We will progress the movement each week. And by the end, we will be working towards what we call a home care plan. So it is an outline of a plan that you can work on. We usually work on that or give it out on the 4th or 5th week, so you have some time to think about it. And then we can talk about it towards the end. And that's just helping to frame out, what does it look like for you? What's a good day? What are the practices that you find resonate with you, that feel good for you, that are providing some space and relief? And how often can you do that every day? Because it's not about practicing once a week or even once a day. The more we practice and embody these tools, the better we get, just like learning a new job or a new sport. And again, you'll be provided with lots of resources along the way, resources from myself and resources from others. And you take what lands with you and leave the rest behind. And this particular program starts on February 5th. It will run every Wednesday from 4:15 to 5:15 in studio or from home. again, they will be recorded in case you're not able to attend. The last group that we ran in the fall, there was many of us that were at home some days and in studio some days. And there's lots of opportunity to ask questions along the way. So I am going to turn off the recording now. And if you have any questions, you can ask. I will also be sharing the recording out, and you can reach out via email to the studio or to myself. And my specific website to reach me at is balancedbreathyoga.ca. You can also contact Vayusha Yoga. Thank you again for your time, and I'll pause the recording.